You've been working with me for about a month now, and I find that your histories and physicals are quite good, but sometimes you get stuck with the differential and you don't know how to move on. Sometimes you want to manage 2 or 3 issues at a time. And I thought maybe we could go over a new teaching technique. It's called SNAPPS, and it's how I'll want you to present your case from now on. So SNAPPS is actually a mnemonic, and it stands for the following. The S stands for summarize. So summarize briefly the history and the physical. And so it's physical, it's pertinent information. Give me the physical exam findings as well. The N stands for narrow the differential. So it could sort of narrow your differential down to about your top 3 or even your top 2. That would be good. The A stands for analyze the differential. It's analyzing the differential, so comparing and contrasting to the other. And I recommend that you use parts of the case. So if there's something that leads you more to think about one differential versus the other, those are the types of things I want you to consider as you go along. The P is for probe the preceptor. Now, perhaps a 2-meter distance, if we could, by asking questions. So if there's something about the case management that you're not sure about, or if you're not sure if the x-ray is the right way to go, if you're thinking maybe about medication choices and you're not quite sure which one to choose, that's when you should be asking me these questions, having an open conversation. The second P is for plan management. So I would expect at your stage you'd be able to plan the management in the room with the patient. So find out what they want, what they're looking for, and you decide together what they might like. Come up with a reasonable plan between the 2 of you. The last S is for self-directed learning. Now, I want you to select a case-related issue for self-study. This doesn't necessarily need to be with every case presentation, but there might be one thing that you don't particularly know about, or you say, I don't really know what that is or what to do with that. And that might be one thing that you can go off and learn about, and we can discuss on the following day. So I'm going to give you this sheet right here because it'll help to prompt you while you go through each case. Why don't you try it with the next patient, okay? So tell me about Donna.
Well, Donna is a woman, 40 years old. I just met today for the first time. She presents with a 4-month history of bleeding between her periods, intramenstrual bleeding. She's in a relationship right now. She doesn't have any kids. She works as an admin assistant actually at a hospital. She's saying that her bleeding in between her periods has been there for, well, bleeding lasts about 3 or 4 days, and when she's getting that extra bleeding, she's using about a panty liner a day. She says she has no particular pain associated with the bleeds, but she does have a lot of pain sometimes when she has intercourse, so deep dyspareunia over the last 4 months or so. And that's about how long this has been going on, the bleeding as well. She has regular periods every 4 weeks. Her normal periods, they tend to last about 7 days, and the bleeding at that time isn't particularly heavy, but she does have a lot of cramps and pain with them over the last few years. She's been sexually active since her 20s, and she's now 40. And she's had a few partners over her life. Her current partner has been stable for the last 5 years. They're in a monogamous relationship, and they have no sexually transmitted infections. She's otherwise a healthy person, no significant past medical history. She's a non-smoker. She's got a normal BMI, and she's coming to sort this out. On exam, and thank you for this, I appreciate this framework, the SNAPPS framework, so I'll keep trying to follow it as I go. On exam, her abdominal exam was actually really entirely normal. I did a bimanual exam. Her uterus was a little bit tender on palpation, but otherwise normal. The speculum exam was normal. At the same time, I decided to do a pap smear and some swabs because she was overdue for a pap smear anyway, and just given her complaints, I decided I would send off her swabs at the same time. So my differential, so again, for the N, so I've summarized the case. N is narrow the differential. top 3 and any bads. Okay, so my differential at this time would be dysfunctional uterine bleeding, and essentially, to be more specific, I would say endometriosis could be the cause, and maybe a fibroid or a polyp. Analyze the differential. Okay, so to go through the differential, dysfunctional uterine bleeding is probably pretty common at this age, but it's pretty much a diagnosis of exclusion. So I was thinking that maybe I should try to rule out the other causes first. So endometriosis can occur at this age. You can have intramenstrual bleeding and spotting and some painful intercourse. And actually, well, I'll be honest, the patient wondered if that's what it was herself. So I thought, that's probably what it is. So I'm kind of going with endometriosis at this point.
So is there anything else that you can think of that could cause the deep pain and dyspareunia?
Oh, I suppose a polyp or a fibroid could have deep dyspareunia, as well as the bleeding or spotting during the periods and in between periods. I guess now it says P, probe the preceptor. Is that what you were thinking? Is there any other diagnosis you think we should have on our list?
I guess the only other one would be adenomyosis. Have you thought about that?
I gotta admit, I don't know much about that. So, yeah, I'm gonna have to look that up. That's obviously for later, that's gonna be one of my self-learning issues. So, as far as the P, planning for management, we discussed her symptoms together, her problems, what we thought it was. I was thinking maybe we could send her for a pelvic ultrasound, do a CBC, see if she's anemic, how much blood she's lost, wait for the result of the pap smear and the swabs, and then meanwhile prescribe her some NSAIDs for her pain. I have to admit, I'm not entirely sure what's the best NSAID to look up, so I think that's also for S, select a self-directed learning issue. I'm going to look up which NSAIDs we often use to manage this, and I probably am going to have to look up what adenomyosis is, because that's a diagnosis I'm not very familiar with.
Okay, let's discuss this with her when we go back in.
Sounds good.